Hey, what is up? Who's out there? Who is out there that needs to hear it's all going to be okay? Because that's what I'm telling you tonight. 28 days now. 28 days in a row that I've been telling you. It's all going to be okay. I know that it's going to be okay. So, who's ready to hear it? I see Irene and Allison are ready. Nicole is watching. Jill is watching. It's great to see people jumping on. And I'm telling you, it's all going to be okay. There's some new information out there today. There's new information every day. And, I don't want you to be watching the news and getting yourself brought down all negative and all that. But I want you to be empowered with facts. And I want you to know that it's all going to be okay. I'm certain of it. Now, that being said, I don't know if I've said this yet, but I do know people who are personally affected with coronavirus. They are COVID-19 positive. There are people who have been sick with it that I know personally, that have been sick with it for a week and a half, 2 weeks. Healthy people who are active, who run, people who do exercise at the gym regularly, people who do just intense sort of things, people who work hard. I mean, we're talking about people that are active, not just people that are sitting around. I mean, these are people who you wouldn't expect to get sick necessarily, that have gotten sick. So I know these people personally, and I know people that are struggling. I know the people that you would otherwise think are healthy with the level of exercise they're doing, that it's just totally knocked them down. They just walking upstairs, they have trouble breathing. And it's just even doing any minimum activity really is tough. And I know someone personally who is in the fight of their life right now. Couldn't breathe anymore. Actually has been intubated and is on a ventilator. So I've never said that this isn't real, and it's real, and I've said that, and that people are going to be affected. There's people dying, and so it's serious. That's why we take the precautions that we take at our house with our family, the precautions that we take in our office. We do take this seriously. And so, but what I want you to know is that it's all going to be okay. And that when you take a look at, I see Libby's commenting that it's all politically motivated. I don't know if I'm going to necessarily go down that road and say that. There's always politics involved, right? And then it's like, well, who's spinning it this way? Is it the Democrats? Is it the Republicans? Is it China? Is it Russia? Who's doing it to us, and who are we doing it to, and trying to screw each other, and that's always happening because there's politics with everything. But what I do think is that it is about control, and that how much the government can control us and tell you what to do, and you just take it and say, okay, sure, fine. And that goes back to what I've been saying multiple times, is that I want you to think. I want you to have facts. I want you to think about it, and just use your mind to rationally consider what's going on. So I want to thank everybody who has sent me the things that they're grateful for, the list of 10 items, and some people gave me more. And I just want to thank you to those of you that did send me that message. It really means a lot to me. Knowing that you are taking those steps, because I know just the abundance that's out there, and that by you sharing that gratitude and just putting that out there, that will come back to you, and again, putting that energy out into that universe will spread to others, and whether they hear it or not, they'll feel it just because you're putting that energy out there. So I got some facts and figures here. My hair this is getting long. I don't know how much longer I can handle this, but that being said, hey Sandy, if you forgot to send it today, you can still send it. That's fine. So Libby's saying the friends working in New York City hospitals, they're hoarding COVID patients in specific hospitals. Okay, I will love to read more of that so the liberal media can exploit it. Okay, So here's the thing. I'm going to give you some facts because I'm going to go to the CDC website. And again, you can say that might be political too, but I'm going to go to the facts. And so, and this is and you got to do a little bit digging. And so this is the thing too. Like, this isn't on the front page. They don't necessarily want to make this so popular for you to find. You do have to look a little bit deeper for this. But this is up to date. This is week by week. So just some interesting facts. Again, we know that the elderly are at greater risk of death with COVID-19. There is zero deaths in the United States for children under 1 year of age. Zero kids have died under one. 1 to 4 year old, there's been one death. 5 to 14 year old, there's been one death, and there's been 7 deaths in the United States for 15 to 24. So that's 9. 9 people have died under the age of 24 attributed to coronavirus. That being said, just as a comparison sake, to, again, I know people are like, you can't compare it to the flu. It's not the same thing. Well, and this isn't like for the year. Like, I'm talking, this is during the time period from February 1st to April 11th. So this is during our COVID crisis. The number of flu deaths for under 1 year old is 10. For a 1 to 4 year old is 26. For 5 to 14 is 34, and 35 deaths from 15 to 24. So you're looking at that's 110 deaths. 110 deaths versus 9. 110 versus 9. Now, it does change when you get up into the elderly population. In fact, I'll say it's about even from 35 to 65. Once you get over 65 years old, when you look at the numbers, that's where it does increase a little bit. And by a little bit, I mean 50% more people died from 65 to 74 for coronavirus versus the flu. And again, this is the same period of time, February 1st to now. There was a almost 90% increase compared for 75 to 84, and it's double for 85 and over. But what I want you to realize is that these facts, these aren't just right out there. Like, you got to dig. It's on cdc.gov / bunch of letters / all these, and I could send it to you if you want, but the facts are out there. So there's no question that the number of deaths is high. But again, people are like saying you can't compare it to the flu. Well, you can compare it to the flu. For the same period of time this year, right now, March 1st to today. The facts are there, the numbers are there, it's right there. So that's where it's at. So again, is this worse than the flu? I don't know. I will tell you what's worse than COVID, though. It's pneumonia. So I'll give you some pneumonia facts here, because this on the CDC website, on this page, it compares COVID deaths, deaths from all causes, pneumonia deaths. They even have a pneumonia and COVID combined. They didn't even separate those cases out. They kept them together because they're like, I don't know, was it COVID? Was it pneumonia? It's both. And then flu. So they compared all of those things. So when you look at the numbers for that, and let me find where the heck on the page I was looking for. Oh, right here. So when you compare, and again, this is during this period of time. So the total number of deaths from February 1st to today from COVID on the CDC website, is 6,930. 6,930. Now, I will tell you that when I looked in the mass media, it was 23,000 plus that they said had died. I don't know how there's a difference between what the media is telling you, what your government is telling you, and what's actually in the CDC on their website. What I can also tell you is that the number of people that have died in that same period of time for pneumonia, not pneumonia plus COVID, because the pneumonia plus COVID deaths are 3,161. But the number of people that have died from pneumonia in the United States in the same period of time, February 1st to today, 38,000. 38,672 versus 6,930 for COVID. Pneumonia. CDC website. The facts are right here. If you want the website, message me. I'll send you the link so you can go and look at it for yourself because the numbers are there. And so, in fact, I will tell you that the only week, there's only 1 week in the past since February till now that there was more deaths of COVID than pneumonia. It was this past week, and it was 15 more. There were 15 more deaths due to COVID this past week than pneumonia. Every other week, pneumonia blew it out of the water. Even 1, 2, 3, 4 weeks ago. 4 weeks ago, pneumonia had 3,800 deaths, 434 for COVID. The week after that, 2,000 deaths with COVID, and there was 4,600 with pneumonia. So I just want you to realize, were you panicked about pneumonia? Were you worried about pneumonia at all? At all? Ever? Thank you, Libby, for chiming in, coming in from Albany. And speaking of that, so let me just tell you a little something about this. Is that, and the flu deaths in that time period, 4,718 compared to 6,930. So, yes, there is about almost a 50% higher percent of deaths than flu, but pneumonia, it's not even in the same category. So I take care of a bunch of healthcare workers. I know a lot of different healthcare workers. And so Libby talking about Albany, I was talking with a medical doctor from Albany who was telling me that the emergency departments out there, they're not even getting challenged with this illness. Their ventilators aren't even being challenged with the number of uses that they have. It's beyond elective care and doctors getting, and nurses and providers being furloughed. They're actually furloughing people in the emergency departments. I was talking today with two people and I'm not even going to say which hospital, but one of the hospitals in Utica that they actually are sending people home in terms of providers and staff, that they don't need them in the emergency room. That this past week, depending on the day, there was 4 or 5 people in this one hospital in Utica in their emergency department. Like that's what they're getting. That's all that's coming in. And then out in Syracuse, talking with one of the nurses in the emergency department out there at one of those hospitals, same thing. They're furloughing half the people. Like they're prepared. They've got all the ventilators. They've got all the preparation that they need, but there's nobody coming. And I say there's nobody coming. There's people coming. I mean, there are, but it's a small amount. So what has happened is this. We as a society, I think that we've done our job thus far in terms of trying to help flatten the curve, as we're told. Flatten the curve. Keep those numbers down so we're not overwhelming the system. Now, areas that are getting overwhelmed are areas that have a high population density. Like, it's not natural to pack 8 million people into 5 square miles, all right? That's not sustainable, and that's not necessarily normal. Now, it's great for financial needs, but it doesn't take care of humanity. So it's not sustainable. And if you look at where the areas where this is really exploded is in those areas. A nursing home is the same thing. I mean, you're taking people who are already sick, already on the verge of death, you pack them in a small area, and then the staff there is overwhelmed and can't handle when everybody gets sick all at once. And then what are they going to do? They have to send them to the hospital. If they go to the hospital, then they come back, and then what do you do? So our healthcare system has not been overwhelmed like we were being scared that it would. We've done our job. So congratulations. We've helped flatten the curve. We've been socially responsible. We social distance, wear our masks, wash our hands, and do things that we should have. So kudos to us as a society. But here's the fact of the matter is that, so Libby's saying, and again, respiratory therapist here, Libby's saying 85% of COVID patients recover with mild symptoms. I saw that it was like 95%, but he's in the front lines exactly dealing with this, so he may know a little bit better. But today, our governor and other governors are saying that they're going to get a plan to help reopen the economy, reopen businesses, and the way of life that we're living. So here's the thing with that, is that it needs to happen soon. Like, you got to have a plan, I get it, but you can't sit back on this for too long. Because the fact of the matter is, and I said this on a previous video telling you that it's all going to be okay, is that whenever we're free to go back to doing what we were doing before, our normal lifestyle, when that happens and everybody gets mixed back together, there's going to be a spike in COVID cases. And there will also be a spike in deaths. I mean, that's just the fact of the matter. There's going to be a spike in pneumonia cases. There's going to be a spike in flu. There's going to be a spike in cold. There's probably going to be measles. There's probably going to be chicken pox. I mean, there's going to be something else that we've never seen before, because these bacteria and viruses are mutating right now while we're sitting in our homes. So when we go back out and connect with each other person to person, there's going to be a spike. But we've got to deal with it and understand that, number one, we've done our job, and it's not going to overwhelm the healthcare system. Our healthcare system is ready. Our healthcare system is so ready that we've sent half of them home or more. That these healthcare workers are sitting at home saying, I should be working, but I'm not working because there's nothing to do, because there's nobody coming in. So we're prepared and we're ready to go as a society. Once everybody goes back and we get back to things, there is going to be, with that spike of illness, some panic, some concern, no doubt, but we got to ride it out. You got to be confident. We're going to get through this, and it's all going to be okay. And it has to happen soon. And the reason why I say that is this, because we're looking at the illness that and the trend of the period of time of this spike, this curve, whatever you want to call it, that it's going to take a couple of months. So let's say, and I don't think it's going to be May 1st. It could be, but I doubt it. But let's say it's June 1st, and I think that that's more realistic, is that if June 1st is we all go back and the world opens up again, if it's June 1st, there's going to be a spike, and it's going to go increase illnesses in June and July, and it should be coming back down through August, which is about the time that kids are going back to college or in school, and elementary school, high school. It has to happen soon, because you need to give at least a couple of months, and June 1st is the latest that can happen. If things open up beyond June 1st, it will be a complete shit show in the United States. It's all going to be okay, but it's going to be a flippin' shit show, because if you try to open things back up in September, you're going to put all the college students out there, all the high school students, all the kids in school, all the teachers, everybody goes back like that. Boom! And then you're going to have every school is going to be an epicenter. Every single one of them. Right now, if you open things back up, well, now the people that do get sick, they get mildly sick, that have the opportunity to stay home. The kids are already home, and they're going to be home in summer. Just let it happen. Adults are going to be, people are working from home. People are distance learning. They're doing whatever they're doing. If they're going to get sick, be sick now. Be sick now. Fight it through the summer. And then when we all collectively come back, when all the kids are all back to school, you're not going to see it be epicenters in classrooms and schools. And then when that happens, they're going to be forced to close the schools again. So it has to happen now. And if it doesn't, total shit show. So that's what I'm saying, is that we've got to open it up. Things got to get back. And if May 1st isn't the date, it has to be June 1st. If it's past June 1st, it's all still can be all okay. But be ready to ride a little bit further through a big show of shit. So that's the stats. That's the facts. That's my perception and opinion on the matter of when things got to get back. Yeah, I mean, this is just crazy. And this is another Thanks, Libby. Thank you for your support, and thanks for your input too, buddy. Chiropractic adjustment, no doubt, it helps your body function better, your nervous system, your immune system. In fact, I was just talking with a couple of chiropractors today and saying, do you know people who's sick? Who's sick? Does anybody even have any patients that are active care that are sick? Don't know anybody. Don't know a single person. I am in all different chiropractic organizations, locally, statewide, nationally, internationally, and I know of one chiropractor that has gotten COVID. And so there's something to it, all right? So this is another release from the CDC. They do this weekly, a weekly blurb, but it's a 10-page document, but there's a little square box in mortality. It says the percentage of deaths attributed to pneumonia and influenza is 8.2%, which is above the epidemic threshold of 7.2%. So get this. Because this is really just kind of mind-blowing, right, when you think about it. And I'm going to sign off pretty soon here because I don't want to beat this for much longer. And I got the cough now, so watch out. The percentage of deaths attributed to pneumonia and influenza is 8.2%, which is above the epidemic threshold of 7.2. So 7.2% death rate makes it an epidemic. The death rate in the highest country, the highest right now for COVID is 5%. It's actually less than what they define an epidemic as. You're being told it's a pandemic. It doesn't even meet the epidemic criteria. COVID doesn't meet epidemic criteria. Because in the United States, the death rate, depending on what state and area you're at, it's anywhere from at most 2%, but a lot of it is less than 1%. So, flu and pneumonia, CDC handout, PDF document, 8.2%. So, just think about that. Let it set in what you're being told out there and take what I'm telling you. And if you want it, I'll give you the link. It's right from the CDC. It's right there. You got to dig. It's not right out there. They're not telling you. You got to dig. But when you find it, then you're armed with the information and the knowledge and the power to have it here and here, to know that it's all going to be okay. I want to thank you for watching, and I will be back tomorrow for the 29th night in a row. Love and appreciate every one of you.